Raising the bar for youth suicide prevention is the culmination of an extensive programme of work conducted throughout 2016 by Orygen, the National Centre of Excellence in Youth Mental Health, in consultation with the youth mental health and suicide prevention sector and in partnership with young people. Rates of suicide are now at a 10-year high. Sadly, suicide rates amongst young people aged 15 to 24 have been steadily increasing, and suicide continues to be the leading cause of death in this age group. Among young women aged 15 and 19, suicide accounts for over twice as many deaths now than it did 10 years ago. We also know that youth suicides are twice as likely to occur as part of a cluster than adult suicides. Both young people and sector leaders identified that youth suicide is different to suicide among older people. Suicide risk looks different amongst young people, and their support needs differ from adults. As such, youth suicide prevention needs a specific response, one that young people are part of. We're calling for the reinvigoration of our long out-of-date National Suicide Prevention Strategy to be supported by a specific youth suicide prevention plan that's both developed and implemented in partnership with young people and the organisations that support them. Mental health service systems, nationally and regionally, need to raise the bar and provide support to all young Australians, no matter where they live or how they identify. This is particularly important at points of entry into and exit from services. Too many young people at risk of suicide sit on waiting lists for specialist care or are discharged home from services and hospitals without adequate support in place. We also call on the governments, the PHNs and other service providers and commissioners to make sure that the regional systems-based approaches for suicide prevention now being rolled out are youth-friendly and appropriate. Young people we spoke to identified gaps in these models for them, including the focus on primary care. We know that young people are less likely than adults to seek help from a GP. The focus on schools as opposed to tertiary education settings and workplaces. Lack of postvention activities, which is important to limit the risk of clusters, and the limited reference to technology. Technology has significant potential to provide effective interventions to young people at risk of suicide, including 24/7 treatment and support, social connection, and crisis intervention. However, to date, references to and use of technology within suicide prevention strategies and activities have been haphazard, risk-averse, and they fail to fully reflect the views of young people who see it as a crucial part of the new suicide prevention landscape. We also want to highlight the importance of schools and other education settings, where young people told us very strongly that gaps exist in our current approaches. They said that we should stop being afraid to talk about suicide in schools, and that suicide prevention programmes delivered directly to students are required across all education settings, including in tertiary settings. So, what should we do differently? We need young people to be front and centre of the new suicide prevention strategy. We need responses to be evidence-based and acceptable to young people. We need to not be afraid to talk about suicide openly across settings and platforms. We need services to work together to respond appropriately and in a timely manner to all young people at risk. And we need to evaluate what we're doing in order that we can make sure what we're investing in is effective and we aren't throwing good money after bad. None of this is rocket science. The government has just announced a raft of suicide prevention initiatives, and this provides a timely opportunity to raise the bar in terms of our suicide prevention efforts and stem the rising tide in youth suicide in Australia.